DBS Card User Guideline. Every month, approximately 5% of samples arrive with sampling bias. To ensure high-quality service, 3 billion cannot proceed with unsuitable samples. If the sample collection is not properly done as shown in the following cases, patients must revisit the hospital for blood extraction, which may cause 2 to 3 weeks delays for the test procedures. Do and don't guide. Please do not apply insufficient amount of blood. Please do not put the card inside the envelope for shipment when it is not completely dried and deteriorated. Please do apply enough blood to fill all the spots and completely dry before packing. Sampling instructions for DBS card kits. Step 1. Place the DBS card on a clean, dry, and flat surface. Step 2. Fill out patient information. Step 3. Shake the blood in the EDTA tube from side to side to mix well. Step 4. Fill each spot with 3 drops of fresh blood. Step 5. Let the card completely dry at room temperature for minimum 2 hours. Step 6. Fold the card and place it inside the provided plastic bag. Step 7. Enclose a DBS card with the requisition and informed consent forms into a shipping container.